The epidemiology unit confirmed 895 COVID-19 cases from 22 districts of the country yesterday. Of yesterday's daily caseload, the Colombo district recorded the most number of fresh cases with 218. The districts of Kurunegala, Kaluthara and Gampha reported 150, 147 and 129 infections respectively. The caseload in no other districts, however, numbered below 50. 49 infections were recorded from Puttalam, 22 from Matale and 20 were confirmed from Jaffna. Meanwhile, 18 cases each were reported from Kandy, Monaragala and Hambantota districts. A further 91 COVID-19 infections were confirmed across 12 other districts. Also among yesterday's caseload were 15 imported cases. As for today, 783 new COVID-19 infections have been confirmed so far. With the continuous rise in COVID-19 cases in the country, Chief Epidemiologist at the Epidemiology Unit, Dr. Sudat Samaravira, says the only way to bring the island's COVID-19 cases under control is if the people act responsibly in the days to come.
There is a very, very big role to play by the public in order to control this disease. The most important thing is at this moment cancel or postpone similar activities that gather people even in a lesser number as much as possible. Also, all the people should stay at home as much as possible. If you are coming to the society, you should wear a mask properly to fit into your nose and face, covering them. And also you should maintain your physical distance all the time when you are in the society, and also you should keep your hands clean, especially when you are entering into a premises and when you are leaving that premises, and again when you are returning back to your home. You should wash your hands properly with soap and water, or should use alcohol containing sanitizer to clean your hands.
He also urged the people to seek medical attention immediately if they display symptoms of COVID-19 and to stay at home.
If you are having any signs and symptoms of COVID like fever, cough, sore throat, difficulty in breathing, chest pain, you should not come into the society, should immediately seek medical advice, and if necessary should do a PCR or rapid antigen test and should confirm whether you are having or not COVID-19. And should act accordingly medical advices. These coming weeks are very crucial to the country. What will happen is the disease will be spreading very rapidly and will have larger number of cases. That will be a very big burden to our health system and also to the country's economy.
With the COVID-19 particles said to occupy closed, poorly ventilated spaces for around 1.5 hours after being released to the air via droplets, Professor of Immunology and Molecular Medicine at the University of Sri Jayawardhanapura, Neelika Malavage, offered clarification as to what airborne transmission in this scenario really means.
Usually, the COVID virus is transmitted by droplets, these heavy particles which don't go beyond like 1 or 2 meters. So this is why we have this social distancing concept, because droplets don't go any further. And that is the main mode of transmission. And that can happen outside as well. But this airborne transmission is transmission of the virus by tiny airborne particles. And that happens in very overcrowded, airtight, poorly ventilated environment.
She then elaborated as to how closed spaces greatly contribute to the spread of COVID-19.
If somebody is wearing a very strong perfume, if you are in a very closed environment, when it's not ventilated, you know that there's a very strong perfume there, and that's because the perfume becomes aerosolized. And if there are several people in that room wearing a very, very strong perfume, the smell will be even stronger. And even after those people leave that room, because it's very poorly ventilated and tightly packed, you can still smell the perfume. So this is how coronavirus causing COVID can be transmitted by aerosol generation in very poorly ventilated, overcrowded environments like restaurants and bars, where there's a lot of people intermingling. There is hardly any ventilation, movement of air, so that the high virus concentration can be there.
Professor Malavage then explained how the airborne scenario within confined spaces with poor ventilation differs from an outdoor scenario.
Take a different scenario, like somebody wearing a strong perfume and going to the seaside. Nobody can smell that perfume. That is because there's a huge amount of airspace and the perfume particles are very, very diluted. So because of that, this airborne transmission is negligible, impossible to happen in outside environment. So this is why it is advised to prevent the transmission of COVID, you have to be in very ventilated areas. So if you have rooms which are tightly closed and poorly ventilated, it is important to open the doors and windows so that air flows through, so that there is not a high concentration of coronavirus concentrated in a room. When somebody is in an outdoor environment, because of the ventilation and the blowing of the wind, there is no way that the airborne transmission can occur. So this is why, given that we do have a new strain which is more transmissible, it is of everybody's best interest to not to go for gatherings, not to go for functions, especially in closed, overcrowded environments.
In the meantime, after 156 COVID-19 patients were confirmed to have recovered from the virus today, Sri Lanka's overall number of novel coronavirus recoveries rose to 94,311. As such, the country's active COVID-19 cases currently stand at 5,766.
ආයුෂ සපිරේ සුප අලුත් අවුරුද්දක් වේවා. ලීව ආයුෂ්